The Ministry of Health, in collaboration with Novo Nordisk Pharma Gulf and Danish Embassy, launched Oman Obesity Clinical Practice Guidelines, which will educate healthcare professionals on how to proactively and efficiently engage in medical management of obesity, and Obesity Epidemiology Study Project, estimating the prevalence of obesity-related comorbidities in the hospital setting and prevalence of top 10 comorbidities will be assessed in the Sultanate of Oman. The two projects were launched today at the Ministry of Health headquarters by His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health, in the presence of His Excellency Mr. Ole Emil Moisby, Ambassador of Denmark to Oman, Saudi Arabia, Bahrain, Kuwait and Yemen. The launch was also attended by Dr. Noor Al-Busaidi, Director of National Diabetes and Endocrine Center. Drawing attention to the rise in obesity-related health issues worldwide, His Excellency Dr. Ahmed bin Mohammed Al-Saidi said,
I'm delighted that we've launched today Oman Compacting Obesity Project in collaboration with the government of Denmark and Novo Nordisk, which is a champion as a company in this field. Unfortunately, obesity is growing worldwide. There are 800 million people at least worldwide who suffer from obesity. Obesity is classified as a disease of its own now, but also it's a contributing factor to 200 other diseases, including cancer. There are 13 types of cancer that obesity is a major factor in. The good thing that obesity and chronic diseases related to it are avoidable. 40% of them can be avoided by modifying our lifestyle, i.e. healthy diet and increasing physical activities. And 80% of these conditions can be reversed also if we follow the instruction of healthcare professionals.
Over the past 2 years, the COVID-19 pandemic has highlighted the global issue that is the obesity epidemic, poor nutrition coupled with technology that enables a sedentary lifestyle to have been linked with a rise in the disease.
We have a big challenge all over the world in actually getting many people suffering from obesity. And if you take 2 billion people in the world is overweight, there's actually more people than is underweight, and more people are dying from obesity today than it was just 10, 15, 20 years ago. It requires a concerted action. It requires changes of habits, changes of food habits, changes of sports habits.
A recent cross-sectional community-based survey of the population of Oman found that almost two-thirds, 66% of the population, was overweight or had obesity. The national survey found that Omani nationals had a much higher prevalence of obesity, 35.2%. In addition to this, Omani women specifically were identified as having a significantly higher prevalence of obesity, 40.9%, than Omani men, 28.2%. Similar findings of alarmingly high levels of obesity among women in their reproductive years were also reported in the Oman National Nutrition Survey.
Today, we're Ministry of Health launching Oman National Clinical Guideline and Obesity Epidemiology Study to control obesity in collaboration with Novo Nordisk Pharma Gulf and the Danish Embassy. The effort is continue to address obesity as it is a global pandemic, and it is a pandemic in Oman as well.
The two projects will not only help establish obesity treatment options and how the disease can be best managed, but will also create understanding of the epidemic in the Sultanate of Oman.